First, anticipation, which is identifying the potential hazard at the workplace before they originate during design stage of a process or equipment or formulation of chemicals, or before starting process or work operations. This enables to anticipate potential health risks through process characteristics, physicochemical properties, possible health effects, past experience, and similarity of the chemical structure to a known hazardous chemical. Second, recognition, which is knowing the hazards that pose to adverse health effect. How to do this? Number 1, by revising available document or information in relation to material, process, equipment, and control measures. Number 2, by conducting workplace observation to identify hazards, understand the process flow, and work practices. Number 3, by performing interview to get feedback from management, supervisors, workers, and panel doctor. Symptoms and complaints among the workers can be ascertained without jeopardizing their confidentiality. Number 4, by reviewing health or medical records to recognize a causal link between hazards and occupational disease. This can be done through the information obtained from the statistics of occupational disease, incident and accident, health surveillance program, and prevalence of disease, which are the most empirical and reliable to determine the projection of hazards. Do you still remember the potential types of hazard existing at the workplace as discussed in the previous topic? Yes, there are chemical hazard, biological hazard, physical hazard, ergonomics hazards, and physico-social hazard. Evaluation can be done qualitatively and quantitatively. Qualitative evaluation determines degree of hazards, exposure, and the level of risk. Meanwhile, quantitative evaluation measures environmental and biological exposure from the monitoring activities. For qualitative evaluation, determination of the degree of hazards, exposure, and the level of risk is done by referring to the risk matrix. In addition, existing control measures should also be assessed in order to identify appropriate action to be taken. What about quantitative evaluation? Quantitative evaluation involves monitoring activities and measurement using instruments in order to get actual value of exposure. For example, first, personal exposure. It can be measured by using personal sampling device attached to the workers. Second, area sampling. It is carried out to measure general environmental exposure whereby the instrument is located at the contaminated area. After completing the monitoring and measurements, results obtained will be analyzed statistically and compared with the standard values adopted from the recommended references such as Factories and Machinery Act 1967 and Occupational Safety and Health Act 1994. Moreover, biological monitoring can also be carried out to assess chemical exposure by measuring chemicals or its metabolites in body tissues, fluid, or exhaled air. Biological monitoring is particularly useful when chemicals can be significantly absorbed through the skin and ingestion.